There's a UK media company by the name of Joe. It's Joe in all caps. And they decided to talk to people on the street about the cost of healthcare in the United States. What follows is, let's say, absolutely predictable to people who know this issue, but it's mind-boggling to anybody who doesn't know the issue of healthcare in depth. So, if you live in the U.S., you really might not realize just how much we're getting screwed and we're getting robbed because of corporate greed. But if you are uneducated about that, well, this is going to open your eyes.
Ambulance call out, how much do you think that costs?
Zero payment.
Zero payment?
Yeah, zero payment.
No. It costs $2,500.
For real?
Yeah.
Oh, okay, cool.
you look. An inhaler.
$100.
Yeah, you're pretty close. It's a bit more.
120.
250 to 350.
For an inhaler?
Yes.
Man. So if you're poor, you're dead.
So 2 EpiPens. Okay. How much do you reckon they are?
$80.
$600.
$40.
I'm afraid not.
More?
More?
$100.
More.
150.
More.
250.
More.
Shut the fridge.
More.
£300.
Double it.
$600. Yeah. What? Why?
That's a very good question.
$600.
Yeah. Cost of childbirth.
Jesus. 50 grand, something ridiculous now?
Yeah, see, I've blown the figures up in your head now, haven't I? Because they're larger. It's the highest, generally speaking, is about 30 grand.
Okay.
Is that reasonable? You haven't?
Not reasonable at all. It's just like now on a benchmark.
$100? $200?
Dollars.
Yeah.
The average is about 10 grand. It can go up to 30,000.
10 grand for a baby.
Yeah, well, I guess. How much is your child worth?
Yeah. What, is that like the same everywhere?
Yeah, the average is about $10,000. Yeah.
That's mad.
I wonder if you could tell me how expensive you think calling an ambulance out to your location is in America.
I guess it depends on like where you live. It really does. Is there a price for that?
Yes.
Jeez. $100? $200?
$2.5 grand.
For what? Why?
Guys, this is why I do this show. Because we've been so propagandized in this country that a lot of people genuinely don't know that in the rest of the developed world, you go to the doctor or you go to the hospital and you walk out and you pay $0.00. It's free at the point of service. You go in, you go out, you're done. Now, you might think, because you're in the context of the U.S., most of you watching this, so you might think like, that's crazy. But it's not. That's actually the norm in the rest of the developed world. The outlier, the wild thing, the thing that people are like, whoa, over, is our system, which has 500,000 medical bankruptcies every year. We have 30 to 45,000 deaths because people don't have access to basic health care. We have millions of uninsured people. Even if you're insured in many instances, you're underinsured. And so you could still go bankrupt from medical bills, even if you have insurance in many instances. Every single argument you've ever heard against these systems in other developed countries, the universal healthcare systems, the various universal healthcare systems, every single one you've heard is propaganda. Everyone. Doesn't matter what about the wait lines? That seems to be like the number one response from people if they're concerned about moving to a system. What about the wait lines? We have wait lines too. And our wait lines are littered with the dead bodies of people who never even got to see the doctor. That's the 30,000 to 45,000 deaths. But the wait lines over there, you know how they prioritize who gets the care and who needs to wait a little bit? Need. So if you're in desperate need of the care, you get it immediately. Now, sure, if there's some elective procedure, yeah, you might have to wait a little bit. But it's an elective procedure. You're going to be all right. If you're sick, you get help. You go to the front of the line. That's how we prioritize. In this country, it's about the size of your wallet. It's about money. Just so you know, guys, it's not my opinion when I talk about our system being the worst in the developed world. It's a fact. There's the old World Health Organization study. Now, granted, this is old. This is from the year 2000. And according to them, we're ranked number 37 in the world when it comes to our healthcare system. But I agree with you if you say that's outdated. It is. That was a long time ago, man. We're talking almost 20 years ago now. But the Commonwealth Fund always studies this, I think every other year or something like that. And every time they've studied it, they've come back with the same response. And the most recent studies find, when they study just the developed healthcare systems, we're 11th out of 11. And by the way, we pay double what the rest of the developed world pays, and we don't even cover everybody. So our system is fundamentally broken. We can't afford to keep doing it like we're doing it. That's the fact that nobody brings up. Oh my God, how can we afford a Medicare for all system? Our system right now is more expensive. $5 trillion more expensive over the course of a decade. We have to move to a system like they have in the UK or like they have in France or Canada. Now, there's little differences. There's, public funding of public institutions. That's how they do it in the UK. That's the NHS. So it's a public insurance system, but also all the doctors are employed by the government. That's the way they do it there. It's a fully nationalized healthcare system. That's one way to do it. Now, you might say, oh my God, that's too far left. According to many studies, they have the best healthcare system in the world, the NHS. But still, if you say, oh, I don't like that, okay, well, then a French system is public funding of private institutions. So it's still free at the point of service, but the doctors could be privately employed, and you could have like private clinics, private hospitals, and whatnot. So there's different ways of doing it, but the connecting tissue between all the developed countries is free at the point of service. And that's everything. That's super important. So this is why I do this show, man, because I really don't think that people in the U.S. understand just how many people in the U.S., a lot of you guys do because you're viewers of this show, but I don't think many people really understand how screwed we are, how we're getting robbed at every turn. And it is, without a doubt, because of the nature of the system, which is for profit. There's no doubt about that. Just think about it rationally for a second. If you have a middleman and their whole goal is, I have to make a profit for my shareholders. I have a fiduciary responsibility to my shareholders. This is the nature of the system. I have to make a profit. How will you make profit as a health insurance company? You'll make more money if you deny more care. So the incentive structure is a giant problem. They effectively are a price gouging mafia middleman. That's what private health insurance companies are. That's just what it is. So why wouldn't you want to get rid of that rapacious for-profit middleman? Have a single payer, a single insurer, which is the doctor, which is the government, and everything's free at the point of service. In our private system, 80% of the money you pay into your health insurance company goes to actual care. 20% goes to everything else. In our Medicare system, it's about 93% of the money goes to actual care. And that would mean 7% goes to everything else. Doing math in my head, you like that? So it's more efficient, it's more ethical, and it's just better all around, man. It really is. I get it. Right now, we're way far off from that system, so it's hard to conceive of it. But do not have a lazy status quo bias. Because I really mean this, guys. I believe it to my core. I think that that's a stupid mindset. Like, genuinely idiotic. What if we do it this way now, though, so how can we not do it like this anymore? You change it. Like, what do you mean? Yeah, you change it. In 1959, we still had segregation legal on the books. Then, fast forward to the 60s, and we got rid of it. At least on paper. I mean, there's still, unfortunately, a large number, way more segregation than we should have. But there was a time when women couldn't vote. And then we changed it. Now, you could be one of those people beforehand going, but right now women can't vote, and women have never been able to vote here, so that's never going to change. We make it change. We had alcohol prohibition. Then we got rid of it. We can do it. We can make changes. It's not impossible. And it really annoys me when so many people, even well-meaning people, have that lazy status quo bias of like, it's not like that now, so yeah, I know, we should change it. Like, what do you mean? Yes, you're going to have a giant fight on your hands. Yes, you're going to be going up against a behemoth, which is a well-funded monster, which is the for-profit health insurance companies and the corporations, and they're going to lobby like crazy to keep it as is. All the more reason to fight harder and change it. Guys, here's the sad truth. The U.S. healthcare system is the laughingstock of the world. Are you comfortable with that? You're getting screwed in so many ways. You're getting screwed in so many ways. We all are. Did you know the U.S. is the only country that doesn't have paid time off by law? Did you know that? The only country that doesn't have paid time off by law. We need to spread this knowledge, spread this information. I don't usually say stuff like this, but share this video if you're watching it. Share it with all your friends. Put it on Facebook, put it on Twitter, put it wherever. Because we got to get the word out there, man. We got to get the word out there. You're being robbed. You're being screwed. And in so many ways, our system is broken. And you're just part of a giant machine that doesn't care about you. We can change that. We can have paid vacation time by law. Wouldn't that be lovely? We can have a living wage, because right now we don't. We can have Medicare for all. Healthcare free at the point of service. Guys, it's just a matter of priorities. Medicare for all saves money. Yes, it'll come out of taxes, but right now you're paying private taxes, premiums, copays, and deductibles, and you're paying more in private taxes. So why not pay public taxes and pay less and get more covered? Seems kind of like a no-brainer on that front now, doesn't it? So we absolutely can do it, and we should do it. There's no reason we can't do it. If we can afford, are you kidding me? 7 wars? We're bombing 7 different countries right now. We're still in Iraq. We've been there since 2003. We're still in Afghanistan. We've been there since 2001. And now they're trying to add more countries to that list. We can invade everywhere. We can bomb everywhere. We could do an $80 billion increase in the military budget, which we just did. Which, by the way, just the increase in the military budget could pay for free college for everybody. Free college is about $60 billion. We did $80 billion increase in the military spending in 1 year. So we could pay for all that, but we can't have basic things. Basic things that people need. We could pay for corporate welfare like crazy, but we can't have basic things. We could bail out Wall Street to the tune of $14 trillion, but we can't have basic things. No, we can have those things. And now consciousness is rising, and people are getting educated on this stuff. And it's time we all do the right thing. We all do the right thing. We all get out there. We all fight for it. And that's why the answer is Bernie 2020. He's the only one that's really serious about taking things on in the way that might actually work. So we have the answer. We have the vision. We know what to do. It's just a matter of implementing it. I don't want to be the laughingstock of the world anymore when it comes to our healthcare system.